I didn't think I was up next either. Anyway, I'm Diane Morin. I work at Cornwall Community Hospital. I've been employed there for 21 years. And I guess I listened to the stories of these other folks, and I think I'm pretty lucky, and I'm very grateful that I do have employment that does pay me a good wage. The unfortunate part is, being in the healthcare system, we do get to deal with all the individuals who aren't as fortunate as we are. As the industries have been failing, working at the hospital, we get to see those people coming in. And it's not always someone that has physical ailments. There's a lot of anxiety, high emotions running, and that creates physical problems. Our hospital's in major deficit, and we're told that there's no money from the government coming to bail anybody out. So for any of us who are long-standing employees, we're no safer than the next person because you don't know what's happening. It's like anything else. One gentleman had mentioned, the management is still there and they're still running very top-heavy. And the rest of us are told to work harder and do more, as he also had mentioned. And you can only do that to a certain extent, and then you all get ill. And you have a healthcare system telling you don't get ill and don't take sick time, and then you're penalized if you do. But if you're on the inside of that hospital working with individuals coming in that have lost their home, they don't have money for food, those children are coming up saying, well, it's time to register for soccer. Am I going to be able to do that, Mom? There's lots of single parents out there as well, single dads. It affects on the youngsters as well when they're looking at Mom and Dad not having any money, and if you can't have a quart of milk in the fridge, you're surely not going to be out in the football field. Which brings you into the schools, and I think the place is just, our city is going to the dogs. Honestly, the top brass is staying heavy, and the individuals are getting lower. The unemployment rate is notorious, and there doesn't seem to be any help for anyone there. I'm a very strong CUPE member, have been for probably over 25 years, grew up in a union family, so that's where I am, that's what I believe in. But at this point in time, we all have our own unions, but it's time that everyone, I think we need to start looking right across the board, reach out to these individuals that are struggling and having a hard time, listen to their stories and give them a little emotional support, because it sure we wouldn't want to be one of those individuals. But there's lots of union people in this room, there's lots of labor people in this room, and this used to be a labor city. I don't know, I think it's time the message has to go back to Queen's Park on June 25th that we are in dire straits in this city and we do need some help. Our hospital, it's probably one of the highest employers with the highest number at this point in time. For how long, who knows, when the cuts, I was going to say begin, they've already begun. So as they continue, we don't know where we're going to be, but I do think, brothers and sisters, we have to be united and we have to put a fight out together and we have to get our message across. We are in need, and I think we have to fight this in solidarity with everyone. Thank you.